you. Thank you.
She is. Okay.
Hi, it's good to see everyone this evening. So I'm Michelle Frank, and I specialize in working with folks with ADHD. Ellen and I were talking like about a year ago about me coming in and perhaps doing a presentation to y'all. So I was gonna have the whole slide thing and a really formal presentation, and then now I'm here finding myself 9 months pregnant, completely unable to open a PowerPoint presentation as a result. And so I was thinking, well, how can we make this a good time and a helpful time together? And what I've noticed, I've done a lot of talks at a bunch of different local chat groups. What I've really noticed is the format of them, the smaller group setting. The richest part of the talks I've given really doesn't have anything to do with my slides or, my forward presentation. The richest part tends to be the Q&A and connecting around the conversation of what it's like to live with ADHD, to parent with ADHD, to be a partner with ADHD. And so what I'm hoping to do today is just open up and create a space very casually and comfortably where we can converse and we can address some common questions, some common themes of life with ADHD, and just give everyone a space to ask questions that might be on their mind, whether that's for you as an adult with ADHD, or the partner of a spouse with ADHD, or the parent of a child with ADHD, and just have a really good time connecting and talking on these issues in a more laid back environment. So I'm curious, I don't know if I can see, let me see if I can open up the gallery view here. I'm curious to know a bit about who is here. And so if in the chat, if you have access to the chat and you're able to, if you could put maybe if like you're here as an adult with ADHD, you're here as a partner, you're here as a parent, or a professional provider, all of the above, kind of let me know who's in the room.
So you want them to do that in the chat?
In the chat, yeah. If as people are comfortable, no pressure, but if you're comfortable, just throw in the chat, parent, adult, all of it, right? Okay, cool. Thank you, nice to meet you. Awesome. Recently accepted it. A teen and parent and partner, grandma, adult female diagnosed lady. Awesome. Okay. So I think we have a few questions to just, get things jumping off. Okay. Yeah, ADHD and anxiety, common comorbidity there. Friend's husband. Right. And in the ADHD world, there's so much overlap because of the genetic component to this condition. And then, of course, non-ADHD partners will often say they start to feel a little like they've caught ADHD just by in the air, feel a little chaotic in the mind. Wife, husband, daughter, sister, nephew. Cool. Well, welcome everyone. So as we go here, I think what we'll do is we'll start off with some questions that we already have prepared just to get things going. And then what I'd like is if people have questions or comments that they raise their virtual hand. You can do that using I believe the reactions emoji here at the bottom of the screen. There's a raise hand button. And then if there are questions as we go, feel free to put them in the chat box, and then we'll just go through people's questions. If there is a question that maybe you don't feel comfortable asking publicly in front of other people, you can also privately message, I believe, who is the running is it Ellen or Andrea? You're both
We'll both be running it.
The three of us are co-hosting, so
hosting. So you should be able to privately message one of them.
or you, they may be able to.
Or me, yeah.
Too.
You know, the only thing I ask is that questions are, that we keep in mind that we want questions to be applicable to everyone in the room, so that we can make it a we experience as much as possible. So just keep that in mind as we go.
So yeah, they can, but I'm just checking, they can chat with you.
Okay, yeah. So you can send it to me then.
Yeah.
Individually here.
So Michelle, I know that you just said to try to keep it more general to everyone, but there is a question. We know that you've been studying the Gottman method.
Mhm.
I'd like to know how you're applying it to couples where one or more partners have ADHD.
So the Gottman method is a method of couples therapy. It's a couples therapy modality that's based on research that goes back about 40 years now. Started out with John Gottman and his buddy Bob Levinson. And what they did is they started studying couples. And what they started studying predominantly was why couples weren't working. What they wanted to be able to predict what would make couples work or not work. And so they created scenarios and what's called the Love Lab at University of Washington, where which was essentially like a B&B situation, and a couple would go in and just sort of have a day or a weekend together, only they would be also having couples therapy. They'd be having interviews. They would have blood taken and urine samples. So not exactly the most relaxing time. But they would have the couples engage in different forms of conversation, and they would have researchers observe, and the researchers would code facial expressions, tone of voice, whether couples responded to each other's what we call bids. So something like, hey, do you want ketchup on your hamburger? Or, oh, look, there's a pretty bird out the window. Or what a stupid commercial that is. So these micro interactions, they would see how couples dealt with them, not just the big stuff, not just the fights or the loving moments, but these micro moments. And they were able to come up with a system to code these micro moments based on research other people had done. And they became really, really good at predicting whether couples would stay together. They can predict with over 90% certainty whether couples will stay together within the first 15 minutes or less of a conversation. And so that was all well and good, but they came to realize that it wasn't necessarily that helpful for the general population to just know what didn't work. It was interesting, it was fascinating. But John ended up marrying a woman who was a very skilled therapist. And she said, you guys have to use this to do something about it, right? To develop a therapeutic modality. And so that's where Julie Gottman comes into the picture, and as a skilled clinician, and they started putting together different therapeutic exercises, applying different therapy techniques to working with couples in ways that would directly address the problems that they were finding. And then they would study those interventions, and they did that for decades. And so the Gottman method couples therapy is the most well-researched couples modality out there. And it's a modality that's very integrated. We take a look at things like your background, right? Your family of origin experience, deep enduring vulnerabilities over the years, just as much as we take a look at the words you're using to express your feelings or not, the strength of the friendship, how you're communicating, how well you know your partner, how well you stay in touch with your partner over the years. Differences in how people do feelings, differences in how people feel about intimacy. I mean, it just really runs the gamut. So it's very well integrated and it's very broad. But at the end of the day, it comes down to some really practical techniques and exercises that really, really help people. And so that's what Gottman therapy is. But what is helpful to know about it is that there are some key components to what makes relationships work well and what doesn't. So they came up with what's called the 4 horsemen of the apocalypse. And those 4 horsemen are contempt. So that's like looking down on someone, that's condescension, that's sarcastic jokes. Criticism, which is a character attack. Like it's a mean statement, it's critical. You always, you never, that sort of thing. Defensiveness, which is not taking responsibility, blaming, counter blaming. Well, I did that, but you did this, right? And then stonewalling, which is when someone gets emotionally overwhelmed, they just shut down and everything stops. So those are the 4 horsemen of the apocalypse. And what has been particularly helpful in working with ADHD couples is this pattern of criticism and defensiveness that arises when there's inevitably an ADHD moment, and the shame spirals that can come up for the person with ADHD, and the anxiety and helplessness and hopelessness of the partner without ADHD. And so how these cycles start and how they perpetuate is really fascinating. And I found the Gottman techniques to really help people work their way out of that. So, when you're in a partnership with ADHD, something like forgetting to pick up the dry cleaning, a time or two can seem pretty innocuous, but in an ADHD partnership where ADHD isn't well managed and where there are some enduring patterns of conflict or pain, forgetting the dry cleaning can sort of feel like the last straw of the day, of the month, of the week, and can lead to conflict that's really dwells with deeper meaning. It's not just the laundry you forgot, it's me you forgot. It's our needs together as a family that you forgot. And then the person with ADHD is very much, immersed in an inner world of self-criticism and shame around that. Like, I don't mean to forget. I just did. It doesn't, and so now we have this conflict around what it means to leave the garage door open again, or forget to bring home the milk, or run late for the date, or these very ADHD moments. What is the meaning behind them? And how do we communicate about them? And so that's what I spend a lot of time doing with ADHD couples in couples work, using Gottman therapy methods. So we start using the antidotes, right? So criticism, we start backing that up and softening our tone. Instead of you always forget, you don't care about me. So it really seems like you only care about yourself. We start softening that up, and we start saying, I feel left behind. I feel like you don't have my back today. I feel like we're not a team. When these things happen, I really need us to come up with a plan. I really need us to sit down and have a meeting a family meeting every week or every evening. They really need to come up with a solution to this together. Because if we come at it from, you always forget and you only care about yourself, trigger defensiveness, right? Trigger the shutdown, trigger the counterattack, the blame, the criticism back. And when that happens, we're completely unable neurologically to be present and have an adequate conversation about what is truly happening there. And this happens with parent-child dyads. This happens, it's just a relational dynamic in general. It's not just couples. And so when it comes to the defensive partner in the room, then we're working on even just saying, I'm taking this really personally right now. I need a minute. That goes a long way. But the antidote to it truly that will really help your partner is saying, you know what, I understand you felt really let down when that happened. I would too. It makes sense to me you feel that way. And so it's taking a little bit of responsibility and validating. And now we're in an entirely different dance. So I took the long route to answer your question because I thought it was a good segue into the couple's dynamics with ADHD that might also prompt some other questions that people might have in the room, because I see there's several partners and parent-child dyads here. So feel free to ask more about it. But those are some of the Gottman basics and how it directly applies to ADHD work. And someone double check, what is the modality discussed? This is Gottman method couples therapy. It is not specific to ADHD. When, but what we're saying is ADHD is a player at the table. There's you, me, there's, my family of origin stuff, there's your family of origin stuff, maybe there's financial challenges or special needs, children's situation, or maybe, an ill mother-in-law, all these things are players at the table. And ADHD is certainly one. ADHD is in the room. And ultimately our goal is for it to become you and me trying to get ADHD spot at the table, less pronounced, less impeding, less impairing. Brittany, you have your hand raised.
Hi.
Hi there.
So my partner's in the shower, so I mean that's I wanted him to be here for that, but that Gottman method stuff was really interesting, so I probably would want to ask more about it, because that's part of the reason why I'm here. But the other part is just like, as a woman with ADHD specifically, like I struggled a lot. Sorry, my dog's barking in the background. I've struggled a lot over the years, even being taken seriously.
Yeah.
Like it took a long time to get an official diagnosis, because anytime I would bring it up with a therapist, they would be wishy-washy. And like I had a psychologist once it felt like I was talking to a lawyer, and then he made me just stand up next to him and just read off of a list of symptoms from the computer, and it was like really weird and unprofessional. So my question is pretty much, how, as a woman with ADHD, do I find therapists who know what to even do with me? Because I keep hopping from therapist to therapist to therapist, and it doesn't feel like anyone's helping, because like people just do like the small talk thing, and then I don't know how to start conversations when it's just that, like, oh, how have you been? I don't know what to say. And like I'm really looking for something that's more help with coping and how to go through life, and it doesn't seem like very many people know how to help with that. They just do like general talk therapy, and they try to prescribe general SSRI medications when like I need SNRIs, and it's difficult. So I'm kind of like at a loss at this point with where to go.
So I have a few ideas happening at the same time here. I'm going to try to make them as linear as possible. The first is so I actually was on the Take Control ADHD podcast a few months back talking about the Gottman stuff a bit more. And then I also believe I did one on ADHD Couples Palooza like last year on Gottman stuff. And so if you want to hear me talk more about it, I will type in the name of that podcast here.
Yeah, that would be great.
And just my name in case need it.
Yeah, because my boyfriend has very textbook ADHD. Like you look up ADHD in the dictionary and you get him. And I'm very inattentive, so people don't understand that I have ADHD.
Mm-hmm.
So like we're both very opposites
Yeah.
with
Yeah.
that. And then we've had issues and struggles, kind of like some of the ones you were talking about.
I didn't mean that. Yeah, right. And dual ADHD partners have their own interesting dynamic and similar challenges to partners where one person doesn't have ADHD. It's really interesting how that happens. So I'll leave it with the Take Control ADHD podcast if you want to hear me. I mean, I talk more about it when your partner is available. But I am really sorry that you had that experience with that provider. It's really awesome to hear how well you know yourself. And I'm also really sorry you've had to get there on your own. And without the support that we all need and deserve. There is a true lack of ADHD specialists. You know, I had to go, most of us who work with ADHD have some sort of personal link to it that made us go out and learn more because we had to, or because, you know, we were in a setting or an environment where clinically what was coming in was ADHD. And the best way to learn about ADHD is not in graduate school or medical school, unfortunately. It should be. You know, you learn a lot about a lot of other conditions, but it's still pretty sparse. And so it's hard to find specialists in that way. What I will say is that I also don't believe that every good therapist for someone with ADHD needs to be a specialist in it. They have to be ADHD informed, but they don't have to be like me or, you know, Ellen or you know, Andrea out here like up in the world of ADHD, right? And so some of them too are just hiding, unfortunately, and it is a bit of trial and error in that. I think an introductory call, say, hey, how many clients have you worked with ADHD? How comfortable are you in that space? What is your experience with it? And does that go beyond children, predominantly hyperactive white boys? And interview them a little bit. It's okay, you know, to own your own authority on what ADHD means to you, right? You're the authority of your own experience, and you do know more than some might. That doesn't necessarily mean that they'll be a bad fit as a clinician if they have some experience. Are they familiar with groups like CHAD or ADDA? You know, have they heard of ADHD coaching? Like what, you know, have they read books on ADHD? It is okay. I would love it so much if someone would call me and just interview me on this instead of just trust me, because while I'm very true to my word, I think it's important to be an informed consumer. And it's hard, right? You're like, I've had it up to here with what I'm going through and I just need help. And this person should be able to step up to the table as an authority in the field and say, hey, I can help you. And here's why I have this training. But unfortunately, it's not always how it works. Sometimes that interaction is much more casual when you initially set up an appointment and you're both sort of wander around together to figure out where it's going. But don't be afraid to be assertive and don't be afraid to come forward with those questions. You can look at CHAD and ADDA, both have professional directories. ADDA is ADD.org, CHAD is CHAD.org. Both have professional directories. You know, there's a lot more, I think, in the works in the ADHD world around professional unity, development, connection. You know, the conferences used to not have a professional, a day of like professional development, and now they do. So I think you'll start to see maybe some of this come together in the better over time, but there still is this like scatter of people who work ADHD. So one, I would encourage you to like look in, not fully weed out people who are not experts or specialists, and to be assertive. Second is to check the directories. The third is to consider coaching, both individual and group, especially if what you're looking for is more of a concrete here and now. How do I deal with my, you know, with some of these, with time management? How do I deal with activation. How do I achieve some of these goals that are deep dreams in my heart, and my own thoughts and habits are getting in the way? Coaching can really fill a really nice, sweet spot in there too. And you can look up the ACO ADHDcoaches.org, or I'm sure Andrea could help. You're a coach, Andrea, was that correct? Right? Yeah. To help find someone who might be able to fill in there as well. Chad has these groups that are phenomenal, and often have at times have a connection component that can be helpful. ADDA, ADD.org, they have some virtual support programs, like they have a job seekers club, they have a finish your creative project, they have a women's support group. So there's some of that you can also get. And what tends to be the case for folks who are successfully supported with ADHD is that they sort of pull from different modalities at different times based on what they're going through. So sometimes it looks like therapy, sometimes it looks like coaching, sometimes it looks like just going to a local group to be around people who get it. And so being flexible in choosing what you need.
Yeah, and I think that's the struggle. Like, my sister is in school now for psychology and stuff, and I think she was telling me about how a lot of just people like in the psych industry don't learn about ADHD as much as other conditions. And on top of that, the ones that do know about ADHD only know about hyperactive. And
Boys,
so
yeah, white boys, yeah.
Exactly.
Right.
So for someone like me, it's really difficult. People say they generalize in a lot of things, and you think, oh yeah, this person will help, but they don't then necessarily believe that I have ADHD because I guess I wear it well or something, like I don't seem like the type, like the person, but honestly, I can't be on time for anything to save my life. And my house is a cluttered chaos of mess. And like, I have executive dysfunctions issues. So,
Yeah. And it's exhausting to mask, right?
Yeah.
You're probably very adept at masking.
Yeah. And then my
Which,
anxiety gets bad, my OCD gets bad, my depression gets bad, and it's all
absolutely.
And I had to, like you said, I had to find out on my own with my own research that like I maybe have dopamine issues and I have ADHD and I have this. And then if you go to certain people being like, I think this is what I have, they go, oh, what do you know? Like, I'm the professional. Did you go to school? Like, they don't take you seriously when you know yourself. And then it's just exhausting to have to keep jumping from therapist to therapist and telling your life story to everybody, and then you again, like, I'm just exhausted and I'm tired of starting with new therapists, but I'm a mess. So it's like you don't know what to do.
I'm going to put a link here in the chat box that is an ADHD rating scale. And it's a screener. It's not a diagnostic tool, but it's a screener. And I encourage you to take that, fill it out, and take that to your first appointment or to an appointment with a primary care, with a psychiatrist, with a therapist, right? And help create that framework for this is what we're working with. This really is a challenge for me. And it might help speed that along a little bit.
Michelle, if I could just piggyback on what she's saying.
Yeah.
I have my own views on pediatricians giving, prescribing medication for ADHD and diagnosing, but I'd like to know how you feel about that opposed to seeing a psychiatrist or a psychopharmacologist.
So I am really in the camp of see a psychiatrist or in mental health, psychiatric NP, if at all possible. And a lot of pediatricians will tell you, like, we don't, or in primary care will tell you, like, this isn't our wheelhouse, because it's not. They do a mental health rotation and they have reps come to the office, but like, it's not it's not their thing. If it was, then they would be marketing for ADHD care specifically and going to the conferences. So right, but that's just not the world they live in. they're also dealing with croup. Like, how do you stay up to date on ADHD medicine and deal with RSV at the same time, or deal with the flu or COVID or all of these things, right? So that being said, I will say financially, specifically for folks who have poor insurance coverage, high deductible, no insurance, right, going to the primary of the pediatrician can be that first stop and can provide a coverage for folks who might not otherwise be able to find someone who is a psychiatrist or a prescribing NP. But they might have referrals for when you are ready and able to financially take that leap. I mean, a lot of psychiatrists and prescribing NPs do take insurance. It's just, I like that primary care providers fill the gap of coverage for people who might not have the ability to see someone else, or might have a deductible that is just unmanageable for a family. The other thing, sometimes I see people go to psychiatrists for a while and get established. And then after some time, when things are really rolling really well and steady, then they go back to their primary care, and the primary care will continue to do whatever the psychiatrist did. So that's another way you can swing it.
Great answer. Thank you so much.
Yeah. So I see a question here. Hold on, let me just. So social skills with kids with ADHD. I have a book for you that is. Caroline has come and talked to your group at all. But, you can't see it because it's too late. The book it's a really colorful cover. Why Will No One Play With Me by Caroline McGuire, who is fabulous, absolutely fabulous, and trains coaches in providing coaching for kids and families. And she uses a lot of Michelle Garcia Winner's work, who does a lot of social learning theory. There we go. Social learning theory. Basically how you can coach your kid through social skills challenges. It's a lot of times with ADHD, right? We get various forms of social skills challenges. It's a little bit different from like kids on the spectrum. And so it's not always what's immediately thought of with ADHD, but it is a huge component. Things like bullying and being bullied are more likely to occur for people with ADHD. Speaking out of turn, being sort of annoying, not really picking up on cues right away. I'm just, yeah. Right. So to the person who privately messaged me this, yes, that is like a common presentation for a kiddo who's having some social skills challenges related to ADHD. So I really highly recommend this book. I recommend there's an upcoming ADHD conference going on November 4th through the 6th, and there will probably be several sessions on kids and social because it's something people are talking about more and more. You could also look up just general social skills groups for kiddos that age. It takes some time sometimes for kids with ADHD to come into themselves socially. And that can be really hard to watch as a parent. It can just break your heart and be completely maddening because you know this kid and love them so much and how great they are. And then it just does not, and then you watch them interact and you're like, where's this person I know? It's not coming out, right? Which is sort of how ADHD feels. Like I can't show what I really am or how I really want to engage because I interrupt or I tune out or I say the wrong thing. So the solid starting place is Caroline McGuire's work. She's going to be keynoting the conference this year.
Michelle, can you just say a word about the conference? Because I was hoping that we would talk about it at the beginning, but I think we forgot.
Mhm.
Do you want to just, or Ellen, do you guys want to say a quick word about it? Because I think it's really important that everybody knows.
Yeah, Ellen, will you mention it? I want to read some of these questions so I don't miss them.
Just, yeah.
Sure. So starting on Thursday, Chad, ADDA, and ACO, is that how you say it? Are
ACO.
sponsoring
Mhm.
ACO, thank you. A virtual conference. There's over 180 presentations and offerings. It goes over 3 days, Thursday, Friday, and Saturday. Since it's virtual, I think you'll have the recordings available for up to 2 weeks. We did that last year. And you can look through and see what kinds of speakers and topics interest you. And it's not that expensive. What else can I say? What is it? What's the theme? Learn, love, laugh, something like that.
Yeah, it's on a connection.
Connect, yeah.
Yeah, hopefully they'll get back to in-person conferences at some point. But they're trying to give a full experience virtually and even have some, there you go. Francesca has it, even have some like non-presentation times, but times to just connect. And they're trying to build in that like social connection support component, even like a talent show component, like an entertainment component and things like that.
They always have that. So the other thing they have is they have support groups for various subgroups, I guess, people of color, spouses of ADHD, people with, I'm blocking.
I think they have some LGBTQ stuff. They have,
yes.
I don't know if they're having it this year, but in the past they've had, especially at the in-person conferences, they've had substance abuse support programs so that there's also social connection without alcohol involved. So I don't know if they'll be having that virtually in the same way, but usually it's stuff like that.
Yeah, so, check it out. It's going to start on Thursday. Learn, laugh, connect. What could be bad?
Hi, Ellen. I just wanted to also let everyone know that, if you're a parent, you can just attend at the conference sessions that are of interest to you. So they're very specific to topics, and you can pick and choose what's interesting and what's relevant for you as a parent to your child, but you just as an adult. So it's wonderful in that you can really tailor and kind of, it's like creating access for information for you to really chew on, and have also make contacts with other parents and learn from them. So it's a very strong, rich community where people come together and share a lot of both cutting edge information, but also really relevant on a day-to-day basis. Thanks.
Yeah.
Thanks, Isabel.
I agree.
Yeah.
Anything else there? Do you want me to move on to some of the next questions?
Do you have more questions in the chat?
I do. I have some.
Okay,
Yeah, go for it.
So one question was about the assessment process and the decision to medicate. So two different questions tied to, similar point of contact. We were actually talking about this online. So assessment for ADHD can look a few different ways. Some people go the route of getting a full neuropsychological or psychoeducational evaluation. Oftentimes that's when you're doing ADHD diagnostics for kiddos. And it's more comprehensive. It looks like testing memory and testing verbal knowledge and testing math skills and testing executive functioning skills. And the reason why sometimes with kids more comprehensive testing is done than for adults is because of the academic component and the possibility for academic delays or interference, and the need to have appropriate documentation to be eligible for accommodations in the classroom. Most schools will provide some degree of that testing. Some parents opt to go with a private practice who's going to give you, it's going to cost a little bit more, but you're going to get a much more comprehensive evaluation that, you know, and a longer report and things like this. What the school does is very uniform and a bit more abbreviated than what might be done in a private practice setting. So you can get it done either way. But for kiddos, typically ADHD is diagnosed that way through in an evaluation. And again, it's because the school system requires certain test scores and things like this to have a child meet the criteria for an IEP or a 504 plan. Another way ADHD is diagnosed is at a psychiatrist's office, at a pediatrician's office, just based on interview and behavioral observations and maybe some rating scales of behavior. Another way ADHD is diagnosed is with a therapist or a psychologist using, again, interview, observation, and rating scales where you're, you know, never, sometimes, always. Parents fill it out, teachers fill it out, talk to the kiddo, and so you get it done that way. For adults, what we're seeing is the picture is a little more complicated. I used to do neuropsychological testing all the time, be a really big believer in its necessity in diagnostics with ADHD, but time and time again, I saw people come into my office and score okay, but have terrible functional impairment in their real life. You know, you're sitting here with me alone on a, you know, nice day, and no distractors. We're in a quiet room, you know, your scores might look different than if we gave it to you at work or when you're at home. We can't, you know, do a neuropsychological test for, you know, like the ways working memory impairments show up when you're trying to parent or you're trying to get things done in the workplace, or you show up at Home Depot and don't remember what was on your list, and so you end up with a $300 bill of everything it was you didn't mean to buy instead, and then you end up at home without the one thing you did mean to get. And then, right, like these are the sorts of impairments that we can't just sit you down and say, here, take this test of attention on my computer, and then that will show me the rest of your life. ADHD is one of the most impairing psychiatric disorders that there is, neurodevelopmental disorders, because it impacts so many domains of functioning. It's not just an academic impairment. And so some of the testing that's done may or may not highlight the ways in which someone with ADHD truly struggles on a day-to-day basis in these different domains of functioning. It might tell us that when we sit you down at a computer, this is how you score, but that doesn't always necessarily generalize to what happens when you're driving, what happens when you're, you know, like I said, at home parenting. And so with adults, more and more people, unless there's some comorbidities that we want to really assess for, like we think there might be dyslexia happening, we think maybe we're trying to rule out, like, you know, we do a diagnostic interview and we're like, you know, I'm seeing some signs of bipolar disorder here as well. I'm seeing some signs of you know, like memory loss that's secondary to a car accident. You know, then we're saying, okay, we need all the big barrage of tests. But more and more with adults, we're saying, let's sit down, have a good diagnostic interview, spend a few sessions together, do a lot of the rating scales that tell us about your behavior in daily life, and let's talk to someone else in your life to get another perspective on it, see if we can figure that out. Because there isn't a blood test for ADHD. Or a genetic test. There are markers but that doesn't always help us out because we can have the genetic markers for any number of things that never show up. So we don't really know how all of these pieces are going to come together in the future. That's one thing I'm really interested to see. But right now, there are a few different ways to get diagnosed, and they're all valid. They just have different, they're slightly different experiences, and there's slightly different purposes for one or the other. If I have a 23-year-old coming in who did okay, got through school just fine without accommodations, but they're looking, they're staring down a PhD in history, I'm saying we might want to do a psychoed on you and make sure you have the option to have accommodations if you need them and your school requires it. So the assessment process can look a little bit different. The important thing is that it's done by a therapist, so master's level clinician, or a psychologist that's a PhD level therapist, nurse practitioner or psychiatrist, a neuropsychologist, neurologists can diagnose, pediatricians can diagnose. So that's a bit about the assessment process. The decision to medicate is so personal. And I think people have different levels of like different bottom lines, and it's important to either think to yourself or to talk with your family about where that is. At what point do we medicate? Do we medicate just because we get the diagnosis? For some people, the answer is yes. Other people, the answer is no. Do we medicate when their challenges are impacting social relationships, school, self-esteem? Especially when it comes to kiddos, there's different levels of what's the word I'm looking for here? Pregnancy brain, sorry. Not risk, but just there's different bottom lines that different families have depending on how the kid is functioning or not. But basically what we're looking at is, what is your functioning like? And for adults, I think it's maybe a bit of an easier decision. But we're just saying, are you functioning well? Do you have this compensatory skills, or do you feel like things are falling apart? ADHD meds are actually the most effective in terms of doing what they're meant to do when you look at the different categories of psychiatric medication. So they're quite effective for most people. Some people do not respond well to stimulants, and then there are non-stimulant options. But there are some myths around medication too. You can look up ADHD Awareness Month, and they have a whole page on myths and facts about ADHD. One thing you'll find there is myths like, ADHD meds cause addiction. Actually, it's the opposite. A lot of people with addiction issues find sustained remission when they're properly medicated, because you're not self-medicating, right? So things like this. So that's my thing on meds. Another quick question that's similar to this is, what's the difference if my kid is meeting with a neurologist? Do they need to get into a psychiatrist? Not if you're happy with a neurologist and you feel like that care is going well. Neurologists won't always prescribe medication for ADHD. They can, but a psychiatrist is probably more likely to do that. So it probably depends on the focus of the work with the neuro. Okay, let me see here. There's more questions. Okay. 1 second. Oh, a teenager that is struggling to accept challenges and differences. Gosh, is that one hard, right? That's such an important stage of independence, and you want them to own their body, their needs. You want them to own where they're struggling and where they need help and lean into that. And it's an age that can feel like pulling teeth. And so I really feel for you, kind of going through that right now, because it sounds like he's in a different place with how he feels about his challenges, so you might want to try some coaching or therapy first and see if you can kind of work it from that angle. Teens, it's hard. You can't, it's not like a younger kid that's just kind of really more likely to do what mom or dad say. Refuses to see a coach or therapist. Right. Yeah. So my recommendation there is that the caregivers, whether that's mom and dad, grandparents, see if you can get in with a coach, a parenting coach, or a therapist that knows ADHD, and see if you can get some support around how to guide and how to support, what boundaries to set. Because, there's some boundaries getting pushed there, right? And some power struggles ensuing, which is developmentally appropriate, but you add ADHD to the mix and that can be scary. How much do I let you sink or swim is a huge question. A lot of parents have. Where the heck do I set the boundaries? How much freedom do I give them? How long do I let this go on? These are questions that there is no one right answer to, and are terrifying if you're a parent. So I encourage caregivers to get support. If the kid won't, okay, then, we're going to go and we're going to get some input from someone who has some experience here. Yes, yeah. So someone here is in a secondary ed program and dealing with the stress of that. For a lot of people who are pretty bright or high functioning, in some ways, like they can, or just have really good support or compensatory skills, or have parents that are just very, very present, supportive, can get through and then school well enough where it's like, I can mask, I can hide it. My ADHD doesn't show. It's there. It's definitely there. If you look, it's all over the place, but maybe the grades come through. And unfortunately, that's something that it really bugs me when people equate ADHD with what grades you have. It's totally neither here nor there. So ADHD is always there academically, there's just places to look. You look at the backpack, you look at the doodles in the notebook, you look at how often they're falling asleep in class, you look at when they're doing the assignments and when they're not, you look at, are they reading during class? They're so bored and they're trying to get ahead, or they're doing their homework from that was due that morning, or they're doing the homework that's due next week, anything to keep me engaged and stimulated. But the grades can be great. So, hey, we don't have a problem, right? Of course not. But people like that can pass really, really well until you hit a certain point where suddenly the demands outweigh the resources and there's a tip. I definitely felt that heavily in graduate school. Had to get more support than really ever before. But it happens at different times for different people. So I just want to acknowledge that comment. And I see Brittany, you have your hand up.
Hi, yeah. When you mentioned the school thing, it was like a big yes, that old. Like if I were to pull out all of my old school notebooks and show you, like, so much of it is just doodles, like doodles everywhere. And I literally had a college professor once look at me, like, I went to school for photography and this was in a critique class. And my professor literally looked at me and was like, "You look like you're always paying such good attention." And I'm like, "Yeah, Totally. But honestly, I could not pay attention to most of what she was saying. And when she
Yeah.
would look at me, I would just pay attention to whatever she's saying right now and repeat that back. Like I got really good at
Mhm.
faking it to make it seem like I was listening to the whole time because I was embarrassed that I was zoning out the whole time.
And
And
kids with ADHD they learn how to do that early.
yeah.
ADHD are very resourceful
Yeah.
and
And I
very
didn't
good at
know.
compensating.
I,
Mhm.
I I think that was the early days of me thinking maybe I might have ADHD, but all through like high school too, like certain classes, I could never do history because trying to memorize was hard and I hated English, like not because I'm bad at writing or can't write, but because certain forms of writing where you have to do like the sources and the research and everything, like it's so cripplingly stressful to me that I procrastinate it literally until
Mhm.
the last possible minute when my brain cannot procrastinate anymore, and then I would literally be up printing out my papers when I had to leave for class.
Yeah.
So it
Yep.
was like a constant struggle, and now it's like I don't know what I want to do with my life and my career, and I've thought about going back to school, but I'm specifically paranoid of having to write more papers.
Yep.
Like I cannot. So it keeps me, it holds me back because that's why I went to art school, because I was hoping I wouldn't have to write thesis papers. And I don't want to live my life avoiding certain things and not being able to go back to school because all I do is procrastinate things and I oversleep or I can't go to sleep at night, and like
Mhm.
it's hard, and people don't understand that I do have ADHD because I'm not bouncing off the wall,
Yeah. Yeah.
but I have
Yeah.
that.
Yeah.
So that
Absolutely. I
is
think,
absolutely everything you just said was absolutely so like 150% the truth.
well, thank you for sharing your experience. I'm sure a lot of people on the call can relate to that. And it's good to hear the lived experience, not just, like me up here talking about it, but to hear how it shows up in people's lives. Um, there's another question I don't want to miss here, which is, are there special coaches who coach ADHD parents how to parent ADHD teens? And so the program I highly recommend is Impact ADHD. Um, and there's actually a great book written by one of the founders. Diane Dempsey and Elaine Taylor-Klaus are the founders of Impact ADHD. They have a strong online program that helps parents coach. And Elaine wrote a book that I absolutely love that is called Complex Kids, or Parenting Complex Kids. Hold on, I have that one. Yep. Oh, The Essential Guide to Raising Complex Kids. I will put that in the chat too. And so they have a really strong program. This book is really helpful. I have all my parents read it. But also through like the coaches organization, you can also find people who specialize in family coaching. So they meet with the whole family at a time, or they'll meet with the parents, or they'll meet with the teen or the kid separately, and then the parents. So they do different configurations. Andrea could probably speak more to what family coaching or like parent coaching looks like. I don't know if you want to speak to that as a resource.
Sure. So I think with parent coaching, many parents send the kid to coaching and they say, just fix my child. But honestly, it starts from the top down. We're trying to teach executive function skills like self-regulation. So how is the parent trying, how are they being self-regulated when things happen? How are they reacting? Are they staying calm? What is the connection that they're trying to develop with their child? How are they speaking to their child? How are they collaborating? So these are some of the things that parent coaches work on. And again, it's not just fix my child, but how can we change some of your behaviors in order to assist and support your child?
Andrea, do you do some of that, or do you have a
Yes.
network in the neighborhood or the area?
I do parent training, and I have some coaches that do it as well. So happy.
Yeah,
to
so
do it.
email Andrea. There's another question here about women with ADHD. So that's like a subspecialty of mine. And the question is, can you talk about the DSM requiring symptoms by age 12 and women who experience symptoms later? So the Diagnostic Statistical Manual, which is the handbook for formal diagnosis, psychological, psychiatric, neurodevelopmental diagnosis, is a DSM, and they inch forward with ADHD every 5 to 10 years, but never quite get it all the way right. That's my personal opinion. They increase the age of onset. So what that means is that they say, okay, you have to have this many symptoms, and here's the symptoms. You have to have like, so many of these symptoms by this age. To meet the criteria of ADHD, because technically it's like a neurodevelopmental condition, which is true. And in the last iteration of the DSM, when they revised it, they got the committee together, they increased the age. They increased it to 12. Word on the street is all of the professionals in the room were pushing for 14 or older. They didn't get it. Why? I don't know. So it's a point of frustration for a lot of folks, and it's a point of great contention. This idea of, can ADHD manifest later in life? If it does, was it there all along and we just weren't looking for it the right way, or we didn't see it? Certainly there's a great possibility for that, because the research for the first several iterations of the DSM, what we knew about ADHD was based on white hyperactive school age boys, which is a tiny subset of and those boys never aged, right? It's a tiny subset of the population. So how do we compare the experience of an Indian American or African American woman, or a man with inattentive type? Like, where do they fit then if our measurement is this big? So it's hard to encapsulate the full human experience in any of these diagnoses. It is flawed in a way that I don't know that we can ever get beyond, because of the complexity of what it means to be a human being in the world. But the definition is still pretty narrow. A lot of, for instance, girls and women, when they're asked about symptoms of ADHD, might be asked questions that aren't the best indicators. They might be asked questions that are based on hyperactivity. They might be asked questions that are based on externalizing behaviors versus an internal felt experience of inattention. So it begs the question, are we asking the right questions in the first place when we're coming up with the sets of diagnostic criteria? The second piece of this is that there has been some research or some longitudinal study. I think the biggest one was out of, is it Brazil or Portugal? It's a Portuguese speaking country. That showed that they did find some folks who had later in life onset of ADHD. And we're still trying to figure out what that means. We're still trying to figure out why. What we do know is that ADHD, like any other condition that's linked to genetics, is most likely epigenetic, meaning there are things that happen in life that turn our genes on or off, right? I can have like an allergy. I think, for instance, I took an allergy test once. It showed that I was slightly allergic to chicken. I've never had an allergic reaction to chicken in my life, right? So sometimes our genetic markers turn on, sometimes they don't. We don't really understand why you have a set of twins or set of siblings and they have equal risk for ADHD, and why one happens to develop and one doesn't. So the question itself speaks to everything we do not know, and a lot of systemic issues in the psychology and diagnostics. But what I will say is that a lot of girls and women with ADHD tend to see symptoms increase and become more problematic, more distressing, more impairing, and more noticeable based on hormonal cycling. And so we see a lot of girls and women coming in after puberty, a lot during menopause, women coming in and saying, am I getting dementia? Like, what's going on? This brain fog is ridiculous. I'm just not myself, and really worried about that. Now, if we go back, oftentimes you can see elements of ADHD earlier in life. This is really well compensated for. It was more of an internal experience than something that caused an external breakdown. And unfortunately, that's often how ADHD is diagnosed. You run into trouble with school, you run into trouble with work, you run into trouble with the law, you run into trouble with substance abuse, and this is how you get your diagnosis. And so when there's the inattentive type, where you're less likely to have the external behavioral problems linked to impulsivity, it's more of an internal felt experience. It's ADHD can go underground a lot longer. And so a lot of times women who come in who are menopausal, for instance, like if you look back, it's been there. It's just been really well compensated for. And now it's gotten worse because when estrogen upregulates dopamine. So when estrogen is high, dopamine is high. When estrogen drops, dopamine drops. And so this is why a lot of women tend to have increased symptoms of ADHD during the premenstrual period. Pregnancy, let me tell you, can really throw you for some loops there. And then perimenopause and menopause can really exacerbate ADHD because of that hormonal link to dopamine, which is one of the predominant chemicals involved in regulating the ADHD brain. And so, it does happen where ADHD manifests a bit later, and we're still getting to the bottom of why. There's also this question of what is the role of shame with women with ADHD, and how do we work with that? And I'd say a lot of the book I wrote with Sari Solden, we talk a lot about shame in that book, and shame for women, particularly in light of the ongoing gender roles and gender demands in our culture. Women still are faced with more work outside of the office, and all of there are gendered expectations. Sari always said that when she first started doing ADHD work, which was a while ago, I won't age her. What she noticed is that women tended to struggle more in some ways than the men she was meeting with, because a lot of the men had assistants at work and were doing less of the caretaking at home. So I think we see that changing over time, right? We're trying really hard to get to a place where it's more egalitarian, but it's still there. And this demand of perfection, as particularly in areas for women that require a lot of executive functioning skills. So being the family organizer and the frontal lobe of the family, like keeping things organized, remembering so-and-so's anniversary, scheduling play dates, keeping track of all of the extracurriculars, meal planning, these sorts of things, the emotional labor pieces, keeping up with friends and friendships, and women in friendships, as we know, like there can be this intense desire for a lot of connection and a lot of keeping in touch in ways that women with ADHD can really struggle with. And then they just feel like they're terrible friends when they're really not. It's just hard to text back and send the birthday card. So some ADHD doesn't line up with the way that there are some of these gendered demands. And that can cause a lot of shame. What I will say, though, is that men also carry a lot of shame with ADHD, as do people who are non-binary or non-gender conforming. I think ADHD in general creates, it sort of has the side effect of a lot of shame, right? You grow up inherently feeling different in ways that you can't always explain, feeling judged, having failures occur, whether that's real or perceived. But oftentimes there are things like you forgot the homework and you get called out in the front of the class. I can't tell you how many stories of like were like actually really traumatic that people have experienced in the classroom, in the workplace, with groups of friends around ADHD moments, and that leads to this feeling of not being good enough, not being a good friend, worried that any call from the boss means you're going to get fired, they're going to find out, they're going to see the mess, right? Whether that's the desk and drawer, or whether that's the emotional mess that we feel on the inside. And so shame is a huge part of the emotional legacy of ADHD. And the first thing we do for that is we just start talking about it. Brene Brown's work is really great in talking about shame and the ways that it can't survive when it's shared and in the daylight. And so connecting with other people, is who get it. Being in groups like this, it can be so healing. I had one guy I was talking to, he said their ADHD group, this is pre-COVID, met at the local Panera, and he said, I knew it was my group because I walked by the windows as I was about to go in, and I saw everyone had their wallet and keys on the table. And I knew that had to be my people, right? Because they all had them out so they wouldn't forget them, or they were right there in front of them. They had all this stuff. Or being at some of these conferences, people walking late, there's like usually a lost and found at ADHD conferences. And there's a board of like missed connections or things, and people leave post-it notes, and people are rummaging in their bags for things. People are taking meds at a public lunch. And I mean, imagine that. That's so powerful, right? I'm taking my meds, and I can do that in front of someone. I don't have to hide that. Or I lost my room key for the second time, and I got to go back to the desk, and then there's someone else right there asking the same question to get their key too. I mean, it's incredibly healing to be around other people who are on that neurodiversity spectrum who get it. And then the other part of what we do is working a lot on rewriting that narrative, working with self-compassion, working with self-talk. I know it's an expression we hear a lot, but do we talk to ourselves the way we talk to our friend, to children, or our family members? And we don't. ADHDers have really tough inner critics. And oftentimes that has been motivating, unfortunately, in some ways. And so it's this learned repetitive behavior that if I criticize myself enough, then, if I warn myself about the shame and judgment that's coming, then these things will keep me on track. But what we know from, by Beatrice, what we know from the research of Kristen Neff out of Northwestern is that self-kindness actually increases productivity. Self-criticism does not. So those are my thoughts on those few things.
I just want to add,
out of time.
Yeah, Kristen Neff also talks about self-compassion is very different than self-esteem.
Yes.
And more important and valuable it is in terms of just being and how we feel about ourselves in the world. It's more internally than externally based. Sorry, just.
No, yeah. Thank you for clarifying and adding that. Yeah.
Throw that in. So Michelle, it feels like we could keep going, but it's 9:24.
9:23, yeah.
We tell people we're done at 9:15. So for all of you who stayed with it, thank you so very much. And Michelle, let's keep the conversation going.
Yeah, absolutely. I'll be back around anytime.
Well, have the baby first, and then
yeah, that's the goal.
And feel good.
Yes,
yeah.
Also the goal.
Yeah, and for all of you who are still here, check out the CHAD conference. CHAD conference 2021. See what's being offered. At least you'll get to know, even if you don't come, you'll know what kinds of things are being offered, what kinds of things are being talked about, what is available. Yeah. And Michelle, this was just great.
Oh, I'm glad. I'm glad I was able to answer some questions and facilitate some conversation. So I wish you each the best on your journey.
Thank you so much. Thank you. And
Great.
thank you all for being here.
Bye-bye.
Bye.
Thank you.